Welcome to my presentation on prolonged exposure therapy and healing for IPV survivors. The goal of this approach is to support trauma survivors in emotionally processing their trauma while reducing or eliminating PTSD and other symptoms related to their trauma. The key is the emotional processing, which is the catalyst to successfully reducing the symptoms. Clients are helped in confronting any anxiety-provoking or avoided thought situations, activities, and people that are perceived as a danger to them. There are three main components in prolonged exposure therapy. They include educating clients on common trauma reactions, triggers, and symptoms. The use of repeated in vivo exposure, which involves facing feared objects, people, places, and resolving anxiety. Repeated and prolonged imaginal exposure, which involves revisiting or reliving trauma memories and processing memories through emotions and thoughts. There are two minor components to prolonged exposure therapy. The first one is psychoeducation, where the survivor is taught about the nature of the trauma and also the nature of the trauma reaction. And two, training the survivor in slow diaphragmatic breathing, which helps them to reduce anxiety levels and stress levels. This particular case study vignette presents a present client I have been working with for approximately the past 6 months. All identifying information has been changed to protect her confidentiality. Her pseudonym is Jewel Torino. She identifies as female and is age 32. Her race is white or Caucasian. Her ethnicity, Hungarian American. She is a high school graduate. She practices Catholicism, and she is presently legally separated from her husband. Jewel lives in a small town located in southwestern Pennsylvania. She has 3 daughters who were removed from the home and placed in the foster care system after Jewel kept falling asleep during a visit by an in-home worker. Jewel's husband physically, sexually, and emotionally abused her and their children in the home. The family was kept in isolation from family and friends for approximately 15 years and not allowed to leave the home. The children were homeschooled by her husband. Jewel endured beatings that left her with a traumatic brain injury, broken bones, and permanent nerve damage in her spine. The residual effect of the injuries have made it impossible for her to maintain work due to the permanent injuries, severe pain, and difficulty with concentrating on tasks. She revealed that she has been experiencing night terrors for the last month, which keeps her up most nights and have been causing a major disruption in sleep. Jewel blames herself for not leaving or being able to protect her children. The fear of her husband's rage kept her in a constant state of silence. Jewel has been diagnosed with PTSD due to the multiple traumatic events during the marriage and has been over-medicating herself with a prescribed painkiller. She says that it helps with disturbing memories that are too much to deal with at times, and she wishes she could turn off her thoughts. She says she has a hard time remembering what it was like to live a normal life due to the years of abuse. Consequently, Jewel is fearful of being in the home, driving into the city, and being alone. Jewel has several presenting symptoms. She is having night terrors almost on a nightly basis. She is dealing with depression, bouts with anxiety, bouts of crying. She has unusually high levels of fear of common everyday things. She's fearful of being around other people. She's fearful of driving alone. And also she's avoiding certain places. She's avoiding certain things and people. The years of abuse have exposed Jewel to multiple traumatic experiences. Often Jewel didn't know what would trigger her husband to display such behavior, so she lived in terror every day, hoping that she didn't set him off. In addition, she endured emotional and psychological abuse, which left invisible wounds. She was exposed to being manipulated, verbal insults, verbal threats, being rejected by her husband, kept in isolation from her family and friends, and sometimes isolated from the children within the home. Also, she endured imprisonment for 15 years within the home. She was kept in isolation from family and friends, not allowed to leave the home, denied necessary medical attention to tend to her injuries due to the abuse. Also, the children were homeschooled to hide the abuse from the authorities. Jewel wasn't the only one abused within the home. Her 3 children were physically, sexually, and emotionally abused by her husband. They endured medical neglect, educational neglect, and the children were often isolated from Jewel. Jewel shows lasting effects of the abuse by her husband. She has been diagnosed with PTSD. She has depression. She has high levels of anxiety. She has a traumatic brain injury that has been causing severe headaches. She has night terrors almost on a nightly basis. She has experienced guilt and shame because she couldn't protect her children or escape the abuse. She lives in constant fear of her ex-husband, sleep deprivation, and over-medication. Jewel revealed that the most feared stimuli for her was the family home where all the abuse occurred, driving to the city because she wasn't allowed to leave the home and was told to stay away from people, and also being alone. There are 4 specific and necessary steps to successfully implement this approach. They include psychoeducation, breathing retraining, in vivo exposure, and imaginal exposure. Imaginal exposure involves verbal actions where survivors are asked to recount trauma memories aloud. It is completed during the session, as homework, and in between sessions. It is important that Jewel knows that sometimes symptoms decrease or linger on due to avoidance of trauma reminders. It is imperative that Jewel receives a clear description of both therapy tools, imaginal exposure, which would call on her to revisit or recount her trauma experience verbally, and in vivo, in which will encourage Jewel to confront feared situations, people, places, and things. After completing the breathing retraining, Jewel will be assigned homework. First, she will be asked to practice breathing daily to get in the habit of breathing properly, and then also to listen to the recording of this session. After going over the agenda, I will begin to explain common reactions to trauma. This will help Jewel to understand her specific symptoms. And in explaining the common reactions, I will validate and normalize what Jewel is presently experiencing due to her trauma. Also, we will talk about symptoms that are signs of PTSD. After ensuring that Jewel understands the SUD scale, I will work with her to construct an in vivo hierarchy, which will list her most distressing memories from the most distressing to the least distressing. During the construction of Jewel's in vivo hierarchy, she was able to identify her top 4 fears. The first one was the fear of beatings. The second was fear of being alone. The third was fear of driving in a city. And the fourth was fear of losing the children to the child welfare system. After reviewing the common safety behaviors, I will assign in vivo homework for Jewel to do for the week. The one assignment would be for Jewel to use her hierarchy. 2, to select practice items which she can work on to relieve or lessen her stress or fear. And then to use the SUDS form to record any reactions she has during the exercises for homework. At the very beginning of the third session, I will review Jules' homework from last week with her. After reviewing the homework, I will explain today's session so Jules know what is going to occur within today's session. After explaining the agenda, I will explain the rationale for using the imaginal exposure with Jules. And with that explanation, we will also talk about Jules' prolonged and multiple traumas, which will require the identification of the most distressing trauma memory, which is identified at the end of the first session. Then Jules will be asked to confront the most distressing memory of the abuse. During this time, she will be processing her thoughts and feelings about this particular distressing memory. After the imaginal exposure, I will process that particular exposure with Jules. And through the processing, I will use reflective listening and clarification to ensure that I understand what Jules was sharing about the particular traumatic event. After all exposure is complete and processing is complete, I will then assign homework for Jules to complete for the week. And that will include listening to imaginal exposure each day, record SUDS level to track her reactions to the exercises, and she can choose in vivo exercise for the week. Also, she'll be asked to practice breathing retraining to help her manage her anxiety, stress, and distress levels and the trauma reactions. After introducing and reviewing hotspots with Jules, we will review the day's session. After the review of the day's session, imaginal exposure will be done. This will help Jules revisit memories of the physical abuse. Also, she will process the exposure. The next part of the remaining sessions will be to discuss in vivo exposure with Jules. This will help Jules to plan exercises that she can do during homework time or during time she's not in the sessions. After discussing the in vivo exposure with Jules, I will give Jules homework. This will include breathing retraining to help Jules to regulate how she's breathing during times of distress, anxiety, whatever. And also for her to listen to the imaginal recording daily. And then she can record the SUDS levels of her reactions during any period of time when she's doing the exercises. In addition, she'll practice in vivo exercises. And then at the end, she can listen to the entire recorded session once. The final session with Jules will involve reviewing homework with her from the previous week. I will then explain the day's session, what will occur in the final session. We will talk about imaginal exposure and processing. And this will involve helping Jules recount her trauma memory. Also, Jules will review the treatment plan and progress with me. And through this review, I will evaluate and discuss her progress and how she feels her progress has done, how she feels that the treatment has worked for her. And in addition, I will give her positive feedback on all the hard work that she has done, all the effort she has put forth, and for her sharing her trauma history, sharing her experience, and for sharing herself. I will have a talk with Jules that there may be an increase in symptoms, there may be an increase or lessening of memories, there may be triggers that may come and go, and also to see if she wants to explore any other issues that involves her trauma. And she's on the road to reclaiming her life back. There are 4 things to consider when looking at this case. Jules' comorbidity, her level of safety, whether the treatment program was relevant to her particular needs, relevant to her particular culture, relevant to her particular religious background, also whether the treatment was properly structured to what she specifically needed and to her specific type of trauma experiences. Other case considerations need to be looked at: culture relevance to address all cultures that Jewel identifies with, her religious beliefs, her world prior to the trauma, prior to her being married to her husband, and also about her strengths and resources, whether they're internal or external resources. There exist some particular barriers to this type of treatment program. First, client aversion to revisiting trauma. Many clients don't want to remember what happened to them. 2, the possibility of worsening of their trauma symptoms. Also, the avoidance of the trauma. And lastly, the increase in failure to complete treatment. The Christian worldview plays a big part in this particular therapeutic approach. 1, the body, the mind, the spirit. If it's out of balance, then there can be no wholeness. So if the mind is out of balance, then the spirit's out of balance. If the spirit's out of balance, the body's out of balance, which means the whole person is out of balance. So to address this, it would take a multi-dimensional approach. We could address the body, the spirit, and the mind. And once that is addressed, then healing can take place. Once healing takes place, then wholeness is there. The person is whole. In a Christian worldview, God is omniscient, omnipresent, and omnipotent. And as Psalms 34 verses 8 through 19 says, "The Lord is near to those who have a broken heart, and save those who have a crushed spirit. Many are the afflictions of the righteous, but the Lord delivers him out of them all." So God will deliver anyone out of their traumatic experience and abuse. There are 5 particular scriptures that can be correlated to this particular case study and with what Joel has gone through. Isaiah 41:10 talks about how we must keep Jesus as the center of our lives to combat intrusive and obsessive and bothersome thoughts and feelings, which is often the case of trauma survivors. Also, 1 John 3:20, God knows what is happening in our lives and the world. So even in the trauma, even in the abuse, God knows what's going on. 1 Peter 5:7, we must cast our cares on God because he cares. God is a caring God, and he cares how we hurt. He cares that we are hurting. He cares who is causing the hurt to us. Matthew 5:45, we can all experience the power found in God's grace. With our trust and faith in God, God's grace delivers power to us. Power is available to us. So in God's grace, that's what we have to look at for power to survive trauma, for power to survive abuse, like Joel did. 2 Timothy 1:7, God did not make us to fear what we face in life, but the power to overcome it. So what this is saying is that what we go through shouldn't overcome us, but we should overcome it if we keep our faith and trust in the Lord. There are particular limitations to the prolonged exposure therapy approach. One of them is it's primarily based on memory processing. It is a past-focused method. It does not focus on the here and now. It can exacerbate dissociative symptoms of trauma survivors. It's a short-term treatment. It may exclude patients with substance dependence problems, and also the levels of retention and dropout rate are a particular concern. There are some recommendations for providers who want to try to use the prolonged exposure therapy approach. First, they must have flexibility in using their approach. They can't do a one size fits all approach to treating trauma survivors because every trauma survivor is different. Multiple traumas require a multi-dimensional approach. You can't treat one trauma with the same trauma you treat for a different person. Also, the provider must be compassionate, understanding, and non-judgmental, because you're having a trauma survivor to revisit, recount trauma memories that may be very distressing to them. Also, we must learn to embrace the client's resilience that's inherent in every person. So yes, every trauma survivor can be resilient, but you have to help them get to that point. Also, use the client's religious beliefs to help promote their healing. Many people are religious. Many people hold to their faith. Use that as a benefit to treating the person. Future implications involve the expansion of knowledge of the prolonged exposure therapy, also enhancement of trauma outcomes, a more streamlined treatment, reduction of attrition rates, which is a problem right now with many clients dropping out of this particular treatment approach, and also the increased utilization of clients and providers. That is one of the key things that's coming, that more clients will want to participate in prolonged exposure therapy, and more providers will want to use it to treat clients. The future for Jewel looks very bright. Jewel has gained tools to help her combat fear. Jewel's trauma no longer controls her life. She controls the trauma memories. Jewel continues to regain her voice. Jewel gained understanding of her trauma and how to process her trauma. Jewel no longer blames herself for the abuse. As we talked about the abuse, Jewel understands that it's something that happened to her. It's not something that she's caused.